Hello friends, my name is Dr. Jaydeep Varinskar. I am an ophthalmologist and a senior vitreoretina surgeon. I practice at Adityajot Eye Hospital, which is a unit of Dr. Agarwals Eye Hospital located in central Mumbai at Vadala West, opposite SIWS College.
Today I'll be discussing with you about a very important condition which can affect newborn infants and can be potentially blinding if not detected in time, and these children can have blindness for the rest of their life if we are not careful. So this condition is called retinopathy of prematurity or ROP. So which children are predisposed to getting this retinal condition which can have devastating complications if untreated? Children who are born anytime before 36 weeks of gestation or before the 8th month of their gestation or pregnancy, children who are less than 2 kgs of weight at birth, children who have complications after birth which requires oxygen therapy and they are kept in the NICU for few days for treating their complications with oxygen therapy, all these newborns are at potential risk of developing ROP, which can be a devastating complication if untreated and undetected. So, it is very important that all children who are fitting into this criteria get seen by a retina specialist or a trained ophthalmologist, or at least by a trained technician who can take photographs of the retina between 2 to 4 weeks after birth, depending on the age in which they were born, the weeks of gestation they were born. So, all parents are urged to have awareness about this condition so that even if their pediatrician or neonatologist do not refer them to an ophthalmologist, they should insist on an eye checkup if their child was born premature and had low birth weight or had complications, medical complications after birth, to see an eye specialist for a retina checkup. What happens in ROP? In the early stages, there is no symptom or there is nothing which shows that the child has any abnormality in the eye. However, on a retina checkup, we can pick up that the part of the peripheral retina has not developed blood vessels. As the disease progresses, it can lead to various complications inside the eye like bleeding, retinal detachment starting in the peripheral retina, or suddenly developing retinal detachment in the central retina. Over the period of time, this can worsen very rapidly in next 1 to 2 months and almost leads to lifelong blindness if not detected in time in the late stages of ROP. So it is very important that all children who get discharged from a NICU or who are born premature be seen by a retina specialist at the earliest. How do we treat ROP? In the early stages of ROP, no treatment is required, but regular checkup at 1 week or 2 weeks interval is necessary. Sometimes the disease can regress spontaneously with normal development of retinal blood vessels and no treatment required. However, if the disease progresses to the third stage, then there is treatment with retinal laser, and this helps to arrest the disease and prevent blindness. There are some eyes who develop sudden increase in the some chemicals inside the eye called VEGF or vascular endothelial growth factors, which can potentially cause sudden retinal detachments or bleeding inside the eye. So rarely these eyes require injections inside the eye which help to neutralize these chemicals. Of course, these children need very regular follow-up, and if required, additional laser may be necessary after the injections. Children who develop retinal detachment can require early surgery for correcting the retinal detachment or prevention of its progression. and that has to be decided by trained retina specialists who have experience in doing such surgeries. So, my request to you all is to be aware of this potentially blinding condition for young children or newborns, and make sure that all children who are born premature with low birth weights to see an eye doctor at least between 2 to 4 weeks after birth to prevent potential blinding complications with ROP. Thank you.